Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. Today we're going to talk about Medicaid expansion, but before we do, down below in the description box is a link to the Healthcare Advocacy newsletter, which is the text for today's newsletter. All of the studies and news reports and analyses that I mentioned and actions, they're all in that newsletter. And of course, you can subscribe there for free and get this stuff delivered to your inbox every day. So let's start. Medicaid is a joint federal-state project to provide health insurance to the nation's poor. As of October 2023, there were a little more than 87 million people in the U.S. on Medicaid, about 25% of the U.S. population. Originally, Medicaid applied to people who were at or below the federal poverty limit. And I've included a link in the newsletter so you can see how Medicaid works and where it applies. If you're interested to know how each state and the District of Columbia implements Medicaid, because it's different in every state, it's a lot of different experiments, you can check in an interactive map that's also linked in the newsletter, and you just click on a state and it'll tell you how it works. If anybody from one-payer states is watching, I kind of did that for you guys. The amount that states pay for Medicaid, because it is a joint program, varies greatly. It's never more than half the cost, and for many patients it can be as low as 10%. States are allowed also to tax certain medical services that occur in their borders to help recover that a portion of the money they spend so as not to disturb their general budgets. And a lot of states do that. Now, under the Affordable Care Act, states were allowed to provide Medicaid to more people by increasing the income restriction from the federal poverty limit up to 1.38 times the federal poverty limit. Now, it's still not very much money. That's about $34,307 for a family of three. However, states administer the program and they can add additional requirements like employment. States can also decide not to cover certain prescriptions, which is tragic. That can actually sentence somebody to death. If you're interested in an example, I have a link down below to T.R. Reid's book, The Healing of America, where he talks about a young woman that was the victim of that kind of behavior. Anyway, states worried when they saw Medicaid expansion that they wouldn't be able to afford to pay for all those extra people who would be added to Medicaid. It turns out it's well within their capability, and here's how we know. The expansion of Medicaid moved certain patients who were already in Medicaid into new categories for which the federal government paid 90% of the cost, thus saving the states significant money. Additionally, when you have more people needing health services, that helps to keep facilities open, and it increases the state's tax base since more people are needed to care for those new patients. That's more people working who pay income tax, who pay sales tax on what they buy. It actually makes the economy grow. It's complicated, but it turns out that the Commonwealth Fund decided to do an investigation and examined a number of states and found no additional impact to state budgets, which is really good. Anyway, there's a link to that report also in the newsletter. Some states are really proactive with Medicaid because they know a healthy population is good for the whole population. I've seen at least one example where a state prison system signed up people who were getting ready to be released from prison with Medicaid so that they would have no gap in medication or treatment, which is a really good choice. The most recent state to expand Medicaid is North Carolina. It took them about 10 years to do it. The Medicaid expansion, it didn't take that long for them to implement it. It took them 10 years to argue about it. The Medicaid expansion went into effect December 1st, 2023, and it made about 600,000 North Carolinians between the age of 19 and 64 eligible. As of February 1st, a little more than half, 346,000 residents have enrolled. So that's pretty good. Georgia a different story. They began a partial Medicaid expansion in July of 2023 called Georgia Pathways to Coverage. The program covers adults with household incomes below the poverty level who will work at least 80 hours a month. That's their expansion part. The coverage will take effect the month after enrollment is approved. As of October 2023, they had 2,297,930 Georgians covered. If the state fully expanded Medicaid, though, an additional 434,000 people would be eligible. According to National Public Radio, and there's a link to the radio story, this new expansion added 2,300 people. That's a disgrace. We can speculate why some states don't want to expand Medicaid. It isn't the money, because they can look to the other 40 states and examine the effect, or they can go to the Commonwealth Fund report and see how their economies will grow so that their budget will not, the budget for other items will not be affected by Medicaid expansion, because more money comes into their coffers to make up the difference. Anyway, it could be economic, or it could be racial eugenics, which I don't like to think about. That's kind of disgusting. Or it could be a complete misunderstanding of how economies work. Increased demand brings an increase in supply to meet demand. If you think resources are fixed and don't grow, then you do everything possible to protect what you have instead of planning to provide health care for everyone. Possible. There's an answer to the problem, and the answer is, of course, universal health care that covers all of us and does it for far less than we pay now. According to the Congressional Budget Office, who did an analysis of this in 2020, link in the newsletter, if you go to that link and look on page 12, there's a chart there, you'll see that $400 billion is saved every year nationally with universal health care. It's not that Medicaid is bad, but it's complicated, and it's just a Band-Aid serving about 25% of Americans, and it's 25% of Americans, and it's not a solution to the healthcare problem. It's more than 50 different ways to provide coverage, and it's different in each state. What we need is a plan that works for everybody wherever we are. So here's the action. Let's remind our representatives and senators in Congress that we want universal health care. Their contact information is going to be in the resources section below, or you can use ResistBot to send a text message to 50409, and here's the message: sign, SIGN, space, PUURGR. And if you send it, here's the email you'll be sending. I'm your constituent, and I want you to know that Medicaid serves 25% of Americans, but not all the same way. Drug formularies and coverages vary from place to place. The expansion of Medicaid should have helped, but there are still 10 states that won't cover the additional people. Even though the Commonwealth Fund analysis shows that expansion does not affect state budgets. You can read that report here, and I include the link so that maybe somebody on their legislative staff will do it. Okay, all of this, and we still have 25 million people with no health insurance at all. There is a solution, and it's in your hands. It is universal health care, like H.R. 3421, the vastly improved Medicare for All Act. I want you to make the effort to make sure no American is without health care. Enact it for your constituents. Let's talk briefly about COVID-19. A little while ago, we discussed a South Korean study that found that people who were well vaccinated were better able to fend off new variants of the disease, even when those variants were not present when their vaccines were developed. Now, a new study based on 4,605 participants in the Michigan COVID-19 Recovery Surveillance Study shows that the prevalence of long COVID symptoms at 30 and 90 days post-infection was 43% and 58% lower among adults who were fully vaccinated before infection. The study appeared in the Annals of Epidemiology, and they chose the 30 and 90-day time frame because different people use different definitions of long COVID. Long story short, keep your vaccinations up to date. That's what I've got for you today. Down below, you can like, share, subscribe, send me comments. You can also send comments to me at healthcareadvocacy1@gmail.com. And I look forward to talking to you soon. Thank you.